guys, welcome back to my channel. So today I'm going to help you guys with your care plan and time plans that you might be assigned during your clinical placements in your second semester or your third semester of nursing school. I'm not sure if every school is required to fill out forms during the clinical placement, such as care plans and time plans, but if you guys are, like my school was, then I hope this video helps you guys out on how you can be more efficient in doing so and be more prepared. So I'm going to start by showing you guys my sheet that I was given. I'll just show you guys on my iPad, but obviously you guys should probably be printing these forms out so that you can fill them in. School gives us these forms. Let me see if I can make it better. Okay, so you're given this form, and you can see here that you should be writing in your name, the week, the date, and your teacher, so whoever your preceptor is. And then you should be expected to go over each category here, so sex, age, religion, language, code, status, allergies, activity level, history, diagnosis that you think is important, what kind of dressings that you might need to be doing, the diet that the patient is on, any tests, any consults that need to be happening that day. Then you need to go through the diet, how the patient feeds themselves or if they need assistance, the vital signs that you did today, and the lab that you looked at. It could either be the most recent lab, and then you would just put them in, and then you would write down which ones are abnormal and why they're abnormal. So basically that is the information that you are expected to know. So I hope you guys can see that. So basically you would be writing the medication that you would be giving and why you're giving it, and then you would summarize everything. So this is basically a short version of what I was expected to do in my first clinical placement. So this was a more short version that was a bit easier and less time consuming. So the school expects you to usually go through what you'd be doing and organizing your day before you go to your clinical placement. So let's say that we are starting placement at 700 hours. So I would write in 700 hours here. Then I would be writing in what I'd be doing at that time. So I could just say that I would receive report, and then I would just say maybe what I'm going to be looking for when I'm getting report and what information I'll be writing down. And then after that I could say around 7:15 I will be doing my assessments, and then you would just write down what kind of assessment you'd be doing, and you would write down basically what you're seeing, and you would do that continuously through the time. So like let's say around 800 hours I'm doing my morning care, and then that's just documented on the side. So that's basically what you're expected to be doing. So the teacher will obviously guide you through that in your first clinical semester, since that's new for you. And then when you are in second semester of your clinical placement, so that would be clinical 2, I was given a longer care plan to do. This was about 12 pages long, and it goes through the same things in the beginning, so the gender, when your patient was here, the diagnosis, if they had surgery, allergies, clothes status, treatment, activity, everything that you need to know about them. And then it goes through the 12 needs, so oxygenation, circulation, fluids and electrolytes, sensory, status, nutrition, elimination. So you would go through your day and collect the data within the 12 needs, and then you would say what you saw that was abnormal, and you could explain it, and you could write why that might be occurring. And then after that, you would write down a nursing diagnosis here, what kind of goals you have for your patient, and the interventions that you are doing to help with the data that you were seeing that is abnormal. Then you would go through the medication that they're being given. So the medication, the dose frequency, how the medication works, why your patient is on this medication, and what you need to know to do for before or after giving that medication. Then you'd be looking at what labs you see, the latest labs. You would write down which ones are normal, abnormal, and why. And you would just be analyzing that. So that's basically the care plan. It obviously takes a lot of time to do. I would recommend that you see what kind of patients you are at, what kind of patients you normally tend to see, and what kind of things you would tend to see more often with patients within your unit. So let's say for me, I was in an orthopedic surgery unit. I saw patients that had hip surgeries, like hip replacements and total knee replacements. So a lot of those patients, the priority was to help them with mobility, to help them with pain management. We're preventing any bleeding, we're monitoring for any bleeding, such as their lab work and their vital signs, ensuring that they are able to get enough oxygen, and making sure that their medication is not affecting their oxygen, like decreased respiratory rate when taking opioid medications. So that's things that are important that we should look out for, and just helping the patient with their basic morning care and rehabilitation from surgery, and with the intent of encouraging them to basically be able to do things independently so that they can go home. So you would work with the PTOT and the other nurses on the unit to help the patient feel better. So that's basically it in terms of the care plan for the first semester clinical and the second clinical. Then there is also a time plan that is required as well. So basically a time plan is the same thing kind of as the other document. This is where you would write down your plan for the day and what you'd be doing. So I kind of have an example here. At 700 I would arrive and meet with my instructor and my patient. At 7:05 I would meet with my nurse, introduce myself, tell them what skills I can perform. 7:15 I would be reading the transfer shift report, and so on from there. So I would basically be writing out the things that I would be doing for the day, and then on the other side I would have to write down what I actually did and how I adjusted. I think this shows that you are prepared and that you are able to adjust to new and changing situations. So yeah, that's basically the time plan that you are expected to do during nursing school, at least for my program. In terms of how to prepare a care plan when you are on a 2-day placement, that is an advantage where you can have more time to work on your care plan and maybe perfect it a little bit. So sometimes students are put on an 8-hour for 2 days, so 8 hours for like Thursday and Friday, let's say, compared to other students who are given a 12-hour day, which is 1 day a week, and that is one shift, and you have to do your care plan within that one shift. So that's a little bit more difficult because you might not have enough time to do everything. If you are given a 2-day clinical placement, then I have some good tips on how to be more prepared. In terms of preparing a care plan beforehand, I would recommend, obviously you would meet your patient on your first day, and then on your second day you would have them again, so that you would have the same patient and you'd kind of know your patient already, so you would have a good idea of what you would be doing to care for them. So on your first day you should be taking all your data and putting it into your paper. You can also kind of think ahead of what you think will be needed for the patient, such as medication. Let's say, like, if you're already used to giving a certain medication to all the patients on the unit, such as a post-op patient usually has prophylactic anticoagulants, you already would know like what they would be needing. Let's say like heparin injection or whatever that may be. And then after kind of like guesstimating their medications, you can be prepared, research your diagnosis, such as total knee surgery, like what that is, or total hip surgery, just like getting a general idea of what that is. Also, you can get a general idea of different past medical histories that patients might have, such as for orthopedic surgery, what is osteoporosis. So just being prepared, understanding what that is, it will save you a lot of more time. And also I'd recommend bringing a list of your nursing diagnoses with you, just so that you can have a better understanding of what you're writing about if you're struggling in that area. So yeah, those are good things to keep in mind when you're writing a care plan in the clinical placement and you are strapped for time. Obviously, like, a clinical placement care plan isn't gonna be as perfect and thorough as a care plan that you need many weeks to do. And so I think teachers usually understand that, and I think it's just good to be prepared and try to be as thorough as possible, and trying to get all your data on that first day, so then the night of the first day you would write down everything, you would analyze everything, and then you were able to be more prepared for the second day, and that's when you'd obviously hand that in at the end of the day. So yeah, I hope this video just helps you guys get a better understanding of what to expect during clinicals for care plans and time plans if your teacher is expecting you to do that, and what you should maybe be doing beforehand so that you are more prepared and more successful. It's good to bring a drug book with you or make some drug cards for clinical as well, so make sure you guys are doing that. And just being more prepared, just bringing all the things that you need. Just don't forget anything, like your pens, your pencils, your stethoscope. Just make sure you have everything and you guys should be good. So I hope this video helps you guys out. Bye.